From the Comcast Sportsnet studios in the heart of Philadelphia Sports Complex, this is Philly Sports Talk.
Philly Sports Talk, presented by Comcast Business.
Back page today's Philadelphia Daily News. Hard to process. Okafor plays, which only adds to our confusion. On a Thursday night edition of Philly Sports Talk, presented by Comcast Business. Yeah, we're in the Lost in the Woods just like you. Well, most of us. Not these two guys to my left.
Don't go
Rob
that far.
Ellis is here, and Ed Barkowitz is here from the Philadelphia Daily News. Robbie, of course, from CSN, and in a moment, we'll be talking to Dr. Mark Schwartz from Virtua Health, who does not treat either Joel Embiid or Ben Simmons, but we'll get the lowdown on these injuries and to Jahlil Okafor in a moment. But there is a report today from Keith Pompey of Philly.com that says the Ben Simmons foot injury may not yet be fully healed, and that a scan that he had on the foot late last month revealed that despite the fact that the team said at the time the foot was fully healed, it's not fully healed. So what the heck is going on here?
I don't know. I mean, it just seems to get worse, you know, as the days go on with the deception and some of the other stuff that's going on. Brett Brown said that it was clean. And I just don't understand what's happening here. Why can't you be up front? I mean, all it's led to is speculation as to why these guys aren't playing. Now, if we come to find out that the foot's not healed, you understand that. But why did we have to go 3 weeks, a month, whatever this has been, since that scan came
January
out?
24th or so was when they had the scan. Today is February 16th. And as Eddie, I'll post to you what I post to Robbie as we walk in the studio. Do you have any issue if Ben Simmons has to sit out the rest of the season to get this right? Do you have any problem with it?
No, not if
Then why not just say this? Just hold him out for whatever reason.
The cynic in me, the second streeter in me, says you still got to sell tickets, for God's sakes, and that's why Joel Embiid hasn't been put out indefinitely. I mean, I have nothing to base that on other than being cynical, being from Philadelphia. To your point, Michael, he has not played a game since March 14th, since they got thumped by Texas A&M. You would be asking him now, with a setback, to go and practice and hurry up and get in the last 10 games. I want to see Ben Simmons. I want to see how this team is, but not to this detriment. The league is littered with guys who've had foot problems and rushing them back. There is such a thing as rushing them back too quickly. I'm sure Dr. Schwartz will enlighten us a little bit more.
Michael, I thought this, even if we didn't get this latest report, I was really starting to think about the last couple of weeks that this was over anyway. I mean, considering wasn't practicing 5-on-5 yet, and you know what Eddie said. But I can't get over the fact that why the misinformation? Why haven't they been up front about this, other than what Ed said? What is the other motivation here?
Yeah, well, I have a thought on that as well, which we'll get to, but let's bring in from Virtua Health, Dr. Mark Schwartz, who does not treat Ben Simmons nor Joel Embiid, but knows whereof he speaks. Inside access, we go cross studio and welcome in Dr. Schwartz, who comes bearing models of the knee and the foot as well. Doc, show us, first of all, the Jones fracture, which is the 5th metatarsal, which is basically, in this case, at the base of the pinky toe. What is the remedy for that?
Okay, let me just show you on a model what we're dealing with. The metatarsals are very similar to the metacarpals in the hand. And he broke the 5th metatarsal. And there's 2 types of fractures concerning the base of the 5th metatarsal. One is at the very end, and that's called a standard base of the 5th metatarsal. The Jones fracture is notorious where it's at the junction of where the shaft and the base meet. That's a little more distal on the foot. And the reason it's called the Jones fracture is because the blood supply to that area isn't as good. And there's a propensity sometimes for these fractures not to heal. Hence the reason to sometimes surgically fix these with the chances of greater healing. There's an x-ray I brought with me of a recent Jones fracture that I performed. I don't know whether we can bring it up.
We're going to put it up right now.
Good.
So that's a look right there.
So what you're seeing is a screw that is bridging the fracture, and that's very similar to what Ben Simmons has. And basically, before you put that screw in, you put a guide wire in, and then you use a small drill. And that drilling also stimulates a healing response.
So are there setbacks to this, or usually if it's a standard fracture like the one we're looking at now, which is not Ben Simmons' fracture, but a surgery you did yesterday, if it's like that, and the athlete stays off it for the right amount of time and rehabs appropriately, what's the deal?
Well, the NBA actually did a study. They looked at 26 NBA players between 1994-5 season and the 2012-13 season. And there were 26 players who actually had this fracture, of which 85% of them who had surgery came back to their pre-injury level. So the prognosis is very good. Nevertheless, there was a 20% re-injury rate and 10% re-operation rate. So the question is, this is the type of injury you don't want to rush along in terms of return to play. Usually these fractures take anywhere, at the best case scenario, 3 to 4 months, but I've seen these take 4 to 6 months to heal after surgery.
4 to 6 months.
All right, so that answers my question, Doc. I was going to ask you, is he behind, where he should be? I guess is the first part of this thing. The second is, when you look at maybe in comparison to what Joel Embiid had to go through, what's the severity? How serious is this for your, standard breaks here?
Well, Embiid's injury was the navicular bone, which, if you can show on this model, is the inside of the foot, the other side of the foot, where the arch. And that navicular fracture actually has a poorer prognosis in terms of healing. So the fact that Embiid's fracture is healed is great, but it's a bird of a different feather. In terms of the metatarsal fracture, sometimes the scans and the x-rays that we take of these fractures lag behind what's really going on inside the body. So the fact that the latest scan didn't show complete healing doesn't mean that it's not going to go on to heal completely. It's just taking a little more time to show it up radiographically. So I'm not overly concerned at 4.5 months that it's not completely healed. I think the confusion has come when we heard a return to play at one point, and now we're hearing that he's not going to be ready to play right now. So I think if we knew ahead of time that he was not going to play for 6 months, then we wouldn't be at this discussion right now.
Hey, Doc, while he hasn't been doing anything strenuous and he hasn't been doing any 5-on-5 or anything like that, should he be on the floor at all, even shooting jump shots or passing the ball or anything like that? Could that in any way set this back, or is that standard operating procedure here at this point?
It's standard operating procedure for he should be conditioning himself. Nothing wrong with shooting. It's basically the hard running up and down the court, the jumping, the landing on the foot. That's where you can get problems if the fracture hasn't healed yet. But what he's doing now in terms of practice, I'm sure it's standard operating procedure.
All right, so practice is no problem, but the dancing is a different story as we turn to Joel Embiid. And I say that only partially with tongue-in-cheek, Doc. Let's talk about Joel Embiid. And there are 2 injuries here surrounding his knee. One is a reported bone bruise. And again, we point out that Dr. Schwartz does not treat Joel Embiid nor Ben Simmons. But one is a bone bruise, and the other, which we just found out about late last week, is a slight meniscal tear. So tell us what we're talking about here.
Okay, so I brought a model of the knee. So a brief anatomy lesson. The meniscus are the gaskets or the shock absorbers that sit between the femur and the tibia bone. And there's one on the medial side and one on the lateral side of the knee. And that acts as a shock absorber. Then we have the bone, and this is the end of his femur bone. And think of this as the end of a chicken bone, where you have that white, shiny gristle. So this is the gristle, so to speak, on the end of the chicken bone. When we talk about a bone bruise, we're talking about right underneath this area, the bone underneath the gristle area being contused or bruised. 25 years ago, before we had MRIs, you couldn't really make this diagnosis radiographically. Now these bone bruises are able to be seen on an MRI, and now you can see the extent of the injury of these bone bruises. Bone bruises usually occur by a contact, a hard fall, bone being, the femur being impeded down onto the tibia, knee-to-knee contact, fall on the floor. The meniscal tears are usually due to twisting type injuries.
So let me show you the video, which I'm sure you've seen, but there's 2 pieces of video we want to show you that happened 4 weeks ago tomorrow against Portland. Right. And Joel Embiid goes up, little head fake, goes up, and the slam comes down and hyperextends his left knee. What likely is injured on that play in your professional opinion?
Hyperextension injuries could be a ligament tear, possible meniscal tear, but usually we wouldn't see too much of a bone bruise per se, but it's possible. But I believe there was a second injury.
Yeah, there is a second. So that's the end of the first one. You can see the hyperextension of the knee right there, says Dr. Barkan. Here's the second one, and he comes straight down. And you were telling me before the program that likely could be the result of the bone bruise?
Yeah, that could very easily be the side of a bone bruise. You can get a bone bruise from either an initial incident just like that, one big traumatic event, or sometimes it could even be secondary to an overuse injury, a repetitive jumping, landing on the knee. But I would say that second injury was a significant fall.
All right, Eddie?
Doc, given Joel's history, and I mean, you've watched him and you've seen, what is your level of concern? Do you think he could play for 10 years in the NBA?
Well, the NBA also did another study, and unfortunately, the taller the player, the higher the injury rate and the shorter the career. So players certainly over 7'2" have the highest injury rate in the lower extremities. And then you look at players 6'7" and taller, again, much different. They have a higher injury rate in the lower extremities than shorter players.
Suddenly, Doc, we're short on time, as you say that.
Yeah, well,
that's not what we were looking for.
So don't trade Okafor is basically what I got out of that.
Yeah, I hear you.
You know?
Maybe that could go into their thinking. Dr. Mark Schwartz from Virtua Health System, we thank you very much for joining us. We'll talk to you real soon, Doc. Thank you.
My pleasure.
Good job, Doc.